Hello, my name is Jeremy Boulanger-Bonelli. I am a SJD candidate, a Pierre-Elliott Trudeau Foundation Scholar, and Vanier Canada Graduate Scholar at the University of Toronto Faculty of Law in Canada. My research topics are mostly on access to justice, and specifically civil justice in Canada. My doctoral research looks at civil lay justice systems, that is, tribunals in which lay people decide some types of cases. And it also looks at the implications of those systems, as well as the possibility of implementing such a system in Canada. So the article begins by just describing analogies. So analogies are a logical device that we use in our everyday lives. They allow us to find solutions to new problems by referring to similar problems we faced and to the solutions we adopted in that context. My article builds the analogy between healthcare and justice systems a bit more systematically. This is particularly helpful, in my view, for access to justice, because that's also a multifaceted and very complex problem with a range of potential solutions to address it. So I found three main similarities between both systems. First, they both seek to prevent, contain, and resolve problems that cause harm. So those problems share a number of features. In both systems, one of the important issues is to detect problems, because both health and justice problems fall on a range from the most undetectable to the most detectable. In both systems, the problems addressed are also affected similarly by the passage of time. So some of the problems, both in healthcare and justice, are receding over time and just stabilize themselves. But others worsen over time. So both systems do have to address that issue, and one way in which they do so is by prioritizing services based on the urgency of a situation. So the problems with which both systems deal are relatively similar. But a second similarity between the two systems is that they provide only remedies and cannot guarantee outcomes. So in both situations, for example, your doctor cannot guarantee you that you will be cured of your ailment. And similarly, a judge or a lawyer cannot guarantee you an outcome of your case. A third similarity between both systems is that they address problems suffered by a person and not a community. So even when legal cases, for example, have collective aspects, we can think about class actions or other types of collective mechanisms, the justice system still asks people for individual claims. So each person does have to have a legal claim. It's the same in the healthcare system, where the doctor will treat individual by individual, even if a situation has collective health problems. However, in both systems, we can implement prevention efforts that are collective. And so, for example, we have legal education that we can implement to prevent legal problems. And similarly, in the healthcare system, we can have health prevention to prevent collectively our problems. However, if we are to transfer solutions from the healthcare system to the justice system, we also have to consider the differences and specificities of the justice system itself. And there's also public support for people in those two areas, and that's even enshrined in legal instruments and treaties in the Americas, for example. However, it's interesting to note that while public health insurance is widely available in many jurisdictions, the same cannot be said for legal services, which mostly remain in the hands of private litigants who have to pay for those services. So this is, in my view, another potential area where the justice system could draw inspiration from the healthcare system as well. When we look at some countries, we see that the healthcare system is much more decentralized. So people usually can access a doctor or nurse and some simple treatment in their own neighborhood or in their own city generally. But the same is not true for justice systems, where tribunals, generally speaking, are much more centralized. As studies have shown in the past decades, geographical proximity is one of the important aspects of access to justice, especially in rural areas. So we could potentially take inspiration in that respect from the healthcare system and further see whether we can decentralize the justice systems in some jurisdictions. Similarly, while the healthcare system has developed home care services, so doctors and nurses sometimes visit patients at their own home, the justice system generally does not offer that solution. So we could also think about other experiments that we can implement in the justice system to have, for example, lawyers or judges come to the home of people to provide legal services. I believe that the analogy between the two systems, as shown in my article, is robust enough to justify those comparisons, even if in the end we have to remind ourselves that the hypotheses we generate would have to be tested on the ground to make sure that they are appropriate. A solution that works in Canada's healthcare system may not work in the United States justice system. This conclusion is kind of conceptual, so it is applicable in most contexts. And indeed, there are interesting opportunities to draw inspiration from systems all across the Americas, which is why I believe the Access to Justice in the Americas project is so timely and so important. So I hope you found this brief introduction to the topic interesting. If you want the full analysis, I invite you to read my article, which was published in the Access to Justice in the Americas book, and the book is freely available online. Thank you very much, and I hope you enjoy.